And thank you so much for joining us today for this very important conversation, I think, on how journalists we're all coping with covering this pandemic. I'm Nora Lopez. I'm president of the San Antonio Association of Hispanic Journalists. I'm also metro editor at the San Antonio Express News. And now let me introduce to you our moderator today, someone who's near and dear to me. Elaine Ayala, who is from San Antonio. She's a homegirl. Came back to the Express News a little over 20 years ago, and has been a features editor. And in her most current role, she's a metro columnist, a damn good metro columnist. She just won 3rd place in the Texas AP Emmy Awards, so we're very proud of her. This is because she's only been doing for a little over a year, right? It's been 18 months.
It's been about, yeah.
So wonderful, Elaine. Congratulations again.
Thank you.
And I will turn it over to Elaine.
Thank you. Thank you. Welcome, everyone. Over the last 2 months, the newsrooms everywhere have been coping with enormous challenges and changes. For most, heavy workloads have also been coupled with working from home, meeting information roadblocks, and risking exposure to COVID-19. And it's all during a pandemic that may well turn into the story of the century, at least of the young century. With us to navigate this discussion are Lauren Caruba, the health reporter for the San Antonio Express News, and probably one of the people that has been covering COVID for longer than anyone. Bernice Kearney, the news director of KSAT 12, Joey Palacios of Texas Public Radio, Francisco Vara-Orta of the National Journalism Group Investigative Reporters and Editors, who's based in San Antonio, and Vladimir Flores, who's probably the youngest journalist on our panel from Telemundo, and the great Antonio Guillen, who's from Univision San Antonio. SAAHJ decided to put on this panel in part to check in with journalists, just to see a wellness check. How are you doing? Emotionally and otherwise, especially as so many newsrooms face cuts and furloughs and continued shrinkage of our advertising base. So no matter what I ask, for each of you, please start off with telling us how you are and how you're coping. But I'll begin with Lauren Caruba, whose health beat was a quieter beat until Lackland Air Force Base welcomed cruise ship passengers who just turned our world around. So Lauren, tell us what you've been facing and how you're coping.
Yeah, well, thanks so much for having me. Yeah, you kind of hit the nail on the head. You know, normally my beat, which is like health and medicine, so covering public health, our public health department, our hospital systems, things of that nature. Normally it would actually be quite a quiet beat, but, you know, it's become, you know, kind of really central to covering this pandemic. So things have been so much busier for me than ever before. Like my beat would normally not have this much breaking news, but you know, every aspect of the pandemic is a medicine story at its core, a health story. And so I've been very busy since I went back and looked, and my first coronavirus story was February 4th. So you know, a lot of newsrooms kind of started mobilizing and covering the coronavirus as like kind of a collective effort, probably in March. So I was, you know, covering it pretty in depth well before that. And so it's kind of felt like it's been longer than it has, to be honest. You know, I would say that this has been the most difficult part of my career. I'm still early on in my career, and so, you know, that there's that to keep in mind. But, you know, it just feels kind of like an onslaught. You know, normally when we cover like breaking news events or just like really big events that affect the whole country, normally it might last for some days or even a couple of weeks, but normally, you know, news events are not lasting for months on end, where we're having to do story after story after story. And I think that that's been something that I've been dealing with and something that a lot of other people have been dealing with. And so, you know, personally, I've been just trying to do my best to kind of recognize what my limits are, because there were some weeks where I was filing like 5 stories a week, and it's over time, it's just not sustainable. And so I think it's really important for us as reporters to kind of let our editors know when we need a break. And I've been trying to kind of cycle in different types of personal activities to de-stress. Like I go walk my dog every night. I've been reading books that I haven't had a chance to read in months, because normally I'd be busy with other things or I'd be doing other things. And I think that balance is just like a really important thing, and kind of recognizing when you need to take a step back and let your editors know, hey, I need a little bit more support, or I need a break. So I've been taking some mental health days. If I have a particularly busy week, I might take some time off, or I might just take breaks in the middle of the day and go back to work, so that I'm not working straight through. Because I think a lot of us find that from working from home, you can easily work 10 to 12-hour days without even noticing it, because of the nature of you kind of roll out of bed and just start working. And it's a little bit more monotonous than having the routine that we normally have, which would be going into the newsroom, but then also going out to interviews more and talking with subjects more. And that's also been a challenge too, is just trying to connect with your subjects when you can't always be there in person. I think is something that has been really challenging, because normally I would be in and out of the hospitals all the time, but now I'm kind of doing a lot more stuff virtually, or when I do go, I have to take precautions. I went to a hospital last week and I wore a mask and I was sanitizing every 2 seconds, I was in the hospital. And so there are situations where we're kind of doing our best to kind of keep up with the coverage, but then also make sure that we're trying to protect ourselves as much as possible.
Joey, you're in a bit of a conundrum, since everything about your job is about sound and being up close. And tell us how you've coped.
Well, I am not home. I'm not home as much as probably everybody else in this panel. I do go to the station every day, and part of the reason for that is City Hall is now right across the street from the station. It takes me about 45 seconds to walk from our front door to the daily briefings that the mayor has. And a lot of what we used to broadcast is live sound. Our newsroom is about 18, 19 people. Most of us are in the station during regular times, but now I'd say every day there's probably 5 or 6 of us in the newsroom at any given time. We're all spaced out pretty far apart. Some of the changes that we've made in our newsroom is we don't get close to the people that we're interviewing anymore. I actually have this long boom mic now that I use instead of just the regular handheld mic that I've had with me for going on 7 years now. But so it's a little interesting to have to hold, kind of like the way you see sound guys in movies holding their microphones, just so that way it's not in a camera shot. I'm still trying to practice that to make sure that my mic does not get in the camera shots of some of the TV reporters. So that's been a big change, and it's interesting not going to press conferences anymore. When I think Planet K held its press conference not too long ago, I think that was the first time I had left the station in a little bit to go far and actually go to a old style press conference, if you will. One of the ways that I've been coping is when I'm not working, which is not very often right now, I have been playing Animal Crossing quite a bit.
Oh my God.
So that has been my way of unwinding and
it's a video game, correct?
It is. It's pretty popular right now. I think a lot of people are playing it. So that's and I play with my dogs. I try to escape, but I'm a big newsy kind of person. I like to know what's happening every second of the day. I check Facebook very frequently, and most of the major news organizations send me the same push notifications when breaking news is happening. And like Lauren was saying, this is most breaking news situations end after a while. We're going on 2.5 months of just this very long, everlasting news cycle. I remember looking back at the number of stories that I've been doing, like in March. I think I did close to about 40 stories in March, which is a little more than, which is more than usual. And the only 3 stories I did not do were related to COVID, were Super Tuesday and a city council decision that was being made, and the pre-K for essay pack being formed. Everything else since March 2nd or 3rd has all been related to COVID-19. So that takes the crown of the longest coverage on one subject. Well, no, maybe not. Maybe the fire union probably takes the crown for that. But yeah, that's kind of what it's been like the past 2 months.
Bernice, you're leading an entire newsroom and must hear every story imaginable about the problems facing reporters, some of the most gratifying things that reporters are also getting when they're going out there into the community. Tell us how you and KSAT has fared.
So thanks for including me, by the way, on this panel, Elaine. So we started covering COVID in a very different way mid-March. That's when we mobilized all of our team to be able to work from home. It's been a very different thing. We've got producers now who are producing from home, which in February we would say, no, that's impossible. And now the impossible is possible and happening. And everybody in our newsroom has really worked with so much grace, and they've been troopers. Most of our reporters and photographers are working completely out of the building. All of our anchors have been able to anchor from home, or we've got a setup so that they can anchor from home should that be necessary. Most of our producers are producing from home now, and most of our assignment staff and executive producers and our assistant news director are working from home. So the newsroom, we have 97 people who work in the building, who are in the news department, when you add up full-timers and part-timers. And I would say on any given day, on any given day at any different time, there's fewer than 10 in the building. Then we have our directors, and they're in a different area of the facility, and no one in the business office, the sales department, they've all been working remotely since early March. So the newsroom that used to be bustling and loud and lots of people milling about and laughing and shouting perp walk or whatever the case may be, no longer is the same. And I know it's been challenging for our team, and it's been an adventure in technology for our team. Some people, I think, are enjoying the capability of working from home because they can just kind of put their heads down and go. I know a lot of people are missing their colleagues and their friends at work, and that becomes a real pain point. So like Lauren was talking about a few moments ago, we've got people who I'm really trying to push to take some time off, take a day here or there, especially after it felt like we were drinking from a fire hydrant. Every day the news was coming so fast, so furious, everything was changing so quickly, and I could see people were just exhausted and they were frazzled because, and I mean myself too, I kept thinking, my God, when is this going to stop? So we're trying to get people time away, saying, you can't keep working 60 hours a week. You cannot keep that pace up. And I was talking to someone on my team a few days ago, and I'm old enough and have been working in news in San Antonio long enough that I've been through the Persian Gulf War, the first one, the second one, 9/11, you know, all of that stuff, floods and hurricanes and whatever the case may be. And all of that had an end. You know, there was a point where it stopped, a point where it kind of fell across, you know, like you could stop and turn and point your attention to something else that was equally as important. This doesn't seem to have an end, it feels like. And so I think that that's really getting people anxious, and they feel compelled to try to get everything done now because we're such an immediate medium, and we, whether it's pushing out digital content, which our digital team is just fabulous, and they've been killing it on building out content and really doing some great data dives and so forth. But, you know, the TV people, the digital people, all the social, because we try to do so much so quickly and get it pushed out immediately because there is a sense of urgency, I keep trying to tell people, don't worry, we can't do it all. And we can't do it all 5 minutes from now. So we just have to choose our battles. So.
And you know that I'm so glad you're joining us, Nora. You're not a panelist, but I'm going to call on you because you're helping to lead a major newsroom in town that, and I'm biased, but I think that the newspaper has done a tremendous job in keeping people informed, not only online, but in paper, and created this daily coronavirus section. So how have you seen the overview of running this newsroom with so many reporters, photographers who are risking their lives by, you know, they can't fake it. They can't work from home and talk to people. They have to be on the spot. So take a few moments to talk about the Express News and other news sites. Uh-oh, Nora's not there.
Oh, she's muted.
Oh, okay.
Sorry, I've unmuted now.
Okay.
Well, I didn't expect to be a part of the panel, but it's been more work than I think I ever imagined. That's why I was nodding when Bernice was talking, because I feel like I work more now than I did when I was going into the office, because at least there was a separation, it felt, of work and personal, and there was that sense as, you know, 6 o'clock was nearing, that, you know, you got to get home because, you know, you got to feed your family, you got to take your dogs out, you know, and we all have things that are pressing at your back that, you know, make you want to, you know, get out of the office and go home. And that has just disappeared. So it feels like, you know, it feels like I'm working in some way or another from about, you know, 9 to 9 o'clock at night. We put the paper to bed at 10. So it's just been a lot more intense. My biggest concern heading into this, and, you know, when we started to allow folks to start working from home, was the communication. You know, how were we going to be able to effectively communicate? And it's, you know, there are days when it does not go that well. And then there are others when, you know, it does. So this is one of those instances where you have to over communicate. But that's part of what takes up so much time, that you're I feel like I'm on the phone. I have a meeting at 9:30. I get off that meeting, and then it's, you know, call you know, the editor. If I don't get the editor, call the reporter. Then follow up on email with, here's what we discussed, here's what we decided. So it's just constant. And then I spent some time, I'm originally from the Rio Grande Valley, and that's where my mom is. So I actually, when the paper allowed us to work from home, I went down to the valley and I stayed with her, and I was working from her home. And that was hard too, because she's 84. So then in between meetings and stuff, I'm like making breakfast, making lunch, making dinner. So it was a lot. It's very, very hard. But I think the paper, the reporters and the photographers are just really rising to the occasion, not just the Express News, but all of our colleagues here. And as everybody's pointed out, you know, San Antonio kind of got in on this story a little earlier than others because of the Lackland, the cruise ship folks coming to here. So, you know, we were already kind of on edge, and we were already aware of this story, you know, since early mid-February, whereas a lot of other folks, it didn't start to pick up until much later. But I've been amazed at how people have been able to adapt, and how everybody has been able to adapt to doing this remotely, and just still producing some amazing journalism all around.
Antonio, you are one of those journalists that has been carrying all sorts of equipment on your body, on your back, on your shoulders. You're like a one-man television station. So tell us how you're coping, how I think you might have been more ready than anybody to do this, because you already kind of carry the newsroom with you.
Unmute here. Thank you, Elaine, and it's an honor for me to be right here in the company of all of you professionals, and that I really admire at all levels. You know, the newspapers. I'm a big follower of the Express News since many years ago, and I know your work, you and Nora, and also Vara, Vlad over here, Joey. Also, Lauren, this is the first time I'm in front of you. And then Bernice, obviously, to be at that level of performance with KSAT is something that you just need to admire. And I like to be in the company of people performing at this level, all of you, because I've seen your performance. Anyway, I think, yes, I mean, I'm not obligated because I'm a TV news reporter. I've been an anchor, a host, political host. But I think that I just like to be in the middle of things. And right now, since the beginning of this, at the beginning, they sent me with a camera person. And then all of a sudden we realized that there's no such a thing as social distancing if I was with somebody driving in the same vehicle. So then they, put us apart. And now, most of the time, I don't have actually a schedule per se, because right now, since the mayor started the press conference, I've been doing the translation live. So at 6 o'clock, I need to be here home, listening to the TDSA transmission, and then connected with the producer. So we're going, and so my day is being cut in half. So I'm not either day or night. So I need to get going from the very early in the morning. And nowadays, sometimes I cannot see a photographer. Now, and I'm pretty sure everybody, now these things, telephone, a microphone, another telephone, these are our weapons right now. And thank God for technology, because right now, as Bernice can tell you, we are able to actually go live, for anywhere. And maybe people with the newspaper do not know about this, but let me just show you something really quick. And to the people connected, there is something that is called Live View. And this is an app right here. This application allows us TV people to go live from probably anywhere. So there is not much need right now for a humongous live track. Now this is it. Now I can, for example, Elaine, yesterday the live shot that I was doing,
yes.
I was referring to from Las Palmas.
From Las Palmas, yes.
Exactly. So I was using this and using this phone. So I was connected with the producer, but I was going out with this. So technology, I mean, it's amazing, in the last years, what it's been doing for us, TV people at least. And then, of course, many of Joey and Vlad, probably Jorge, they saw me and you, Elaine, with this thing. So I love photography. I love photojournalism. So I'm probably the only TV person carrying 2 DSLRs or cameras with me, because I think this moment that we're going through, it's allowing me to document whatever we're witnessing right now, a historic moment, in a different way. Now I'm using, since I'm on my own sometimes, now I'm using video and the photography in a combination that is allowing me to do something different. And, you know, I'm not in front of my news director, and she's allowing me, she's giving me that flexibility to introduce into my stories my photography with the video that, you know, I might be taking. And yes, I'm carrying a pole mic, a microphone. I haven't been doing a lot of stories at home. I'm not used to that. I don't like it. It seems too easy for me to do the something. That's okay, but maybe I need to be out. I'm taking my precautions. I'm using my face mask. I'm keeping, you know, as much as I can. Sometimes maybe, you know, the microphone is going to be able to get somebody's sound from, you know, 6 feet from me. So I'd rather be out. I mean, definitely, I'd rather be out, because that's the only way we can actually have a sense as to what's going on outside with this pandemic. I don't think it's going to be sustainable to work so many hours, as Bernice was saying right now, because I don't know about you. We're already into 2 months of this, and I've been working since 8 o'clock in the morning all the way to 10 o'clock at night. Yeah. And I've been producing many stories, because the station has a 5 o'clock in the morning, at 11:30, 5 o'clock, and 10 o'clock. And then the press conference, and then the Facebook Lives that we're doing too. So it's a lot of things going on right now. And I think I'm not there yet. I don't know if any of you are, but I think pretty soon we're gonna top. We're gonna get to a point where maybe it's gonna be just too much. And as Bernice was saying, probably, and she's an administrator. She's looking at a big picture. We reporters, we just focus on something and we go for it. She needs to be the big picture as to how her people are doing. And by doing that, she can probably sense that somebody needs to take a break, you know, just you know, disengage from all of this. But at the same time, as Joy was saying, I'm a news type of person. So it is very hard for me to completely disengage from this. Now, yes, I can go to the garage, I can, you know, hit a punching bag, I can do this and that, but at the end of the day, I go back and see what's going on, because, you know, I'm so used to that I cannot get away completely. Now, what am I gonna do? The way that I'm gonna be supposedly disengaged, I was already trying to go out and do a documentary on my own, even if it is not shown on TV. But I probably am gonna be doing that. Now, I was going to just...
Antonio, I'm going to interject just to say that Univision, like several other news organizations, has suffered cuts, has suffered furloughs. Antonio just noted that he would be off this coming week. I don't think that's by choice. I think it's a part of the furlough. So that this is one of the other pressures affecting so many journalists. And I'm going to get to you, Francisco, in a little bit to talk about that and all the other things that are sort of falling off the priority list for journalism. But I'll go to Vladimir. You're probably the youngest journalist on the panel. You also are a one-man band who's out with all his equipment, and you're posting live. You're sending lots of stories in. You are your own station. I'm surprised that both of you don't have like satellites on top of your heads. But tell us how you've been faring and how you've been working.
Of course. Well, at the beginning, when everything started, I don't usually cover health stories So I can tell you that I probably was the last reporter at my station to jump into the coronavirus covering. You know, I usually do breaking news or human stories, immigration, political stories, especially, you know, this year. But then whenever like everything went crazy, they told us to start looking for a different angle of the story. When I started my career 6 years ago, I worked in Telemundo at a station in Dallas. And that's when the Ebola outbreak happened.
Oh my goodness.
I thought it was going to be something similar, you know, a couple of days and that's it. But no, everything started to get worse and worse. And I think for me, it's been like different stages because at the beginning, we wanted to like promote like the face masks, for example. And I think our viewers or interviewers will get kind of offended at the beginning when they saw us like showing up with masks, you know, especially with our community. They didn't really believe this was going to be something big. So it will be hard to get an interview. And then after that, we did like a phone bank receiving questions from our people. And we were advised that, you know, Hispanic people were the most affected and they would never call the call center to ask questions. So, you know, we had to take it a little bit more serious. But then on the other side, like I said, one of my, the type of stories that I like to do is like more human stories. So what I've been doing different is, you know, we have like 3 or 4 reporters per shift. And of course, one of them is going to be covering the major conference, you know, and the reaction to that. And what I like to do at this moment is find like different stories. For example, I did a virtual wedding. I spoke to a bride and a groom and they had a wedding on Facebook Live because their families from Mexico couldn't be here. You know, that's something different. I did a funeral of a World War II veteran last Monday. Only 10 of his family members were able to be there. And they told me the last thing he wanted was to have a big funeral, you know, his last day because of coronavirus. Yeah, so I've been doing all of these stories. I did the couple from Floresville that went viral, you know, because of they were separated. I spoke to them as well. And I think right now, at the beginning, it was really hard. But afterwards, you know, after finding these different stories, I think we as reporters are starting to get a different connection with our audience. Because at this point, I can tell you that, for example, 2 weeks ago, I was working on my story. It was like 7:30 already. I was working on my deadline. And I received a call from somebody that I had done a story before. And that person happened to be related to the youngest victim of coronavirus in San Antonio. So, you know, we had to change everything. And I just feel like personally for me, and I think I'm getting more like attached to our audience. They're giving me more like confidence. And that's really like, that has made my job a lot easier because, you know, we're doing interviews over the phone, on FaceTime. But most of the time, what it takes for them to say yes to an interview is the visual, you know, when you see them in the eye and they need to trust you. And that's been the hardest part for me because I don't have that right now, you know. I have to do it over the phone. But after they see the stories that we do and, you know, everything that we're going through, they kind of understand. And most of the people are agreeing to, you know, speak after maybe losing a loved one because they know and they see the importance of creating, you know, conscious about this that's going on.
Thank you so much. Francisco Vara-Orta is an instructor with investigative reporters and editors, and he's usually in contact with journalists all over the country in all mediums, and he gets to see a bigger picture. So I'd love him, Francisco, for you to talk about how you see coverage nationally, what you see as some of the problems with coverage, what might be falling off our priority lists for newsrooms that you see as problematic.
Sure, so thank you again for inviting me to be a part of this. As I know some of you that are joining, it's been great to be involved with the local journalism community here, being based in San Antonio for our organization. And I think it's easy to say that if you look at a survey of news across the globe, that this is the story of the year that a lot of us didn't expect. At this point, journalists were anticipating another grueling election season. For many journalists of color, it has felt like an incessant political campaign since June of 2015, when Donald Trump came down that golden escalator and first disparaged Mexicans. And so I think that for a lot of journalists, they are still grappling with how to handle this in the breaking news pace, and knowing that this is going to bleed into that time frame of the election, as well as be an issue in the election. The story breaks down into of COVID-19 into public health, covering government, and the business response. So there's not a beat that is not impacted by this, including arts and entertainment, which is kind of left a little out of that, but intersects with all of those in a way. The loss of civic events. I think one thing that the journalism industry has done that's been to its credit has been lifting of paywalls for coronavirus coverage. I'll get to a point about diversity and inclusion in a second, but I wanted to say that some news organizations have been working for the first time ever to translate their content into Spanish. And that's been really important, particularly for communities that aren't as fortunate as us to have strong journalism in Spanish language outlets from like Univision and Telemundo, like we have here in the panel. San Antonio in general has been really fortunate in that we have a strong media community that works together and is pretty collegial, and that we were touched by this so early, like Elaine had said. My organization had had a conference in early March, and one of our attendees among several hundred got COVID-19. And so we immediately had to self-quarantine early in March. When I arrived back home from that, already we had had the person go to North Star Mall. And I think at that point, you know, people were starting to realize this is going to get in the community. So San Antonio had a chance to prove, I think, its journalism chops on a national stage with what local outlets were producing. And I am sure that many of you will go on to be rewarded for your work this year, next year in the award cycle. And that's something that we kind of keep track on because we ask a lot of y'all to be speakers. As far as like working, what other journalists need to be mindful of is, in addition to the public service of making this information public, you're balancing that with commercial demand and economic issues with staffing. So like Elaine said, with furloughs, you can't give it away for free if your model is based on paid content, and that's going to be something that managers need to ethically navigate. Also the intersection with diversity and inclusion. At the same time of this coming out and people realizing yet once again the importance of media, which I think they started to awaken to after the 2016 election due to disinformation and Russian interference, we have not seen a net gain at all with journalists of color and journalists that come from these communities. Pew Research Center in March, at the time all this was coming out, released a study that found that journalists of color, there were about 21,000 journalists of color in the industry in 2008. And then after the recession, and 10 years later measuring it, there were only 22,000 journalists of color. So while we didn't lose a ton, we did not grow very much when the national population of people of color is growing exponentially, particularly amongst the Latino community. And so San Antonio really has a foundation to be an example to the rest of the journalism industry, because we aren't just covering brown and black people, we are brown and black people. And that's not something you necessarily see. The gains made have only been percentage-wise, and that's because of the attrition of white journalists losing their jobs or retiring and not being replaced. And this story disproportionately affects Black and brown people. You know, our Asian brothers and sisters have dealt with a lot of racism because of this. And so my partner works for the city, and they just put out a resolution condemning anti-Asian racism. And people were nationally roasting the city over it. People that normally wouldn't pay attention to our local politics. And I'm sure all of you have dealt with those messages in your work whenever you write about immigrants or whenever you write about people of color or any type of sexism or anything that a marginalized community goes through. And those of us that, you know, we're all Latino, you know, in this room, but we understand a lot of these issues because we're intersectional. These the disease has really affected LGBTQ folks, particularly those that are young, that are homeless, that are trapped at home with abusive partners, which also extends to obviously our straight allies. Those are all stories that are going to need to be continued to be covered. And I think as far as journalists, I worry about their mental health. We are working on an issue that'll be coming out this year at IRE. We have a quarterly publication that will be focusing exclusively on mental health. I keep tabs personally on my friends, and you're dealing with already a lot the last few years with cuts and with dealing with racism and discrimination and the secondary trauma you can get from that. But I think that that's something these managers also need to take into account, is making sure that their staffs get the rest they need and putting in good practices about getting up from your desk every hour and doing those chores and taking your mind off of it, because we are going to burn out at the end of this year if we do not take that as a priority.
Yes. Thank you so much, Francisco. That's, as always, so insightful. I guess now we can go to some questions from the audience. One of the questions that popped up on chat was for the photojournalists, for the broadcast photojournalists who are carrying mics, Joey, Vladimir, and Antonio. Do you disinfect your mics? It's a simple question, but I know it's something we're concerned about. Joey, you go first.
Yeah, I use sanitize wipes just to go over the microphone and also the boomstick. And that's really the only thing that I have that gets close to other people. So just usually just a quick wipe down. And even in the council meetings that I've been attending every Thursday, when people come up to citizens to be heard, you know, the AV folks at City Hall, they'll actually come up and wipe down the microphone between each person. So, you know, for me personally, one quick wipe over the mic, and then I'm ready for the next interview.
You too, Antonio?
Yes, definitely. It's been you need to be in that you know, frame of mind that is not normal. So sometimes, yes, you interview somebody, and then you have to carry, you know, your sanitizer with you yourself. In my case, I wear gloves. But as Joyce said, if I'm using the boom microphone, yes, you need to keep that in your mind that it is nothing is normal right now. So we need to, and I need to do that as much as I can. Sometimes I go back to the vehicle, and after, you know, having interviewed somebody, I even, you know, go and do the whole thing in the inside the vehicle. But yes, it is a new reality that you know, we need to be aware. Basically, it's awareness.
Bernice, one of our questions came from Arturo Chavez, who is the former president of the United Farm Workers. And he asked, how are we going to recover? How are we going to end what's it going to be like at the other end of this crisis? I didn't know that you were a forecaster, but we're going to make you one today.
You know, that's a great question. I wish I knew more. I know that we are collectively, our company is looking at what a newsroom post COVID-19, or, you know, as we continue to evolve, what we're going to be looking like. And I think we're going to still see a lot of people reporting photography, photojournalism, producing from remotely. I think we've got the technology, to Antonio's, to his point with the equipment, we've got the capabilities to get people out from being bunched up, you know, at desks and so forth. I've been reading a lot. I know most of us probably have been reading a lot about cubicles versus open workspaces, and, you know, there's a balance there. I think we have a very open newsroom at KSAT, but we are looking at how do we continue to have the, you know, the newsroom feel and people getting back to work in the newsroom, but being safe and being smart about it and being able to protect those of our staff who either have to or want to work in the building, and doing, you know, rotating schedules. And now that everybody almost has been able to work from home, I think they're seeing and are completely cool with the idea that they might be, you know, like we're cleaning off desks and we're taking a bunch of our home, you know, our little tchotchkes and stuff, taking it home, being much more sparse and spare in our workspaces at work so that we can have more cleaning crews coming through. Everybody gets little wipes. I mean, it's just all of that. So it's hard for me to predict what the newsroom is going to look like. My hope is that we can get some people back in, because it's not fun being in an empty newsroom right now. You know, I love being able to look out in my newsroom, walk around, say, hey, you know, I'm giving out cookies or giving out little treats or whatever. I like that. I miss that. I miss the hustle and bustle and the laughter and the, you know, shouting and the, you know, chit chat and all of that. And it's a very different world right now. So I would love for us to be able to get back to that. But I don't think we're going to get back to, you know, 90 people in a newsroom all at once, sitting, you know, right next to each other. So we definitely are looking at just layout, how we use space, how we stagger work schedules in home, in station. You know, we've got, I mean, my office is now a little mini dispensary of hand sanitizers, alcohol, for spray bottles to spray off microphones and that kind of thing. We've got photographers using boom mics, and, you know, reporters and photographers and everybody in masks. And I've got, you know, a thing of masks for people to come and get. It's just a very different world. And I don't know that we're ever going to go back. I think
agree.
we're going to have to figure out a way to go forward and continue to have the community that is so wonderful in San Antonio particularly, but do so in a way that's safe for those of us, you know, for our colleagues, but also for the people that we come in contact with every single day. I've been very fortunate. No one in our building has gotten sick. And
That was a question I was going to get to for you and for Nora. So tell us, is everybody okay?
No one has gotten sick. Thankfully, but we have also been really proactive about trying to keep them fully supplied with the things that they need to keep them, especially the reporters and photographers who are out in the community. You know, we're doing a lot more Zoom meetings. We're doing a lot more interviews like this for sources. But we, you know, the story is not on a TV or a computer monitor. The story is out in the community, right? So we've got to still be able to go out and cover our community in our community, and not just through a little webcam. I'm glad that we have that technology. I mean, it's great, but it's very different. And that human touch is still so important. So anyway, we've been very fortunate. We've had some great collaboration between stations and so forth. So all the TV stations are now pooling resources, which has been great because it minimizes contact out in the field. And that's really important. And that started really early on. And I would say, I think that's one of the reasons why we've been very fortunate to not have anyone who's been sick, tested positive or anything.
Nora, how about our newsroom? Is anybody tested positive? And then there's so many questions. That was one question from the president of SPJ, but also Lauren, I wanted you to take on in the last few minutes, 2 minutes each. What's the story you can't get? So Nora, anybody sick?
No, we've had employees of the paper be sick. I don't remember exactly how many, but I think we've had about 20 or so. But we've been fortunate that they have not been in the actual newsroom. But you know, that's not to say that some of us haven't been sick. We just don't know it.
But anybody tested positive for COVID?
Not that I'm aware of. I know of a handful of reporters who've taken the test. But I have not been informed of anybody who's tested positive.
Okay. Okay, Lauren, you know, we talked earlier about, you know, the difficulty of getting some stories. Is there a story you just can't get because government or other officials aren't letting you, aren't cooperating?
It's not that there's been stories that I can't get at the moment. I think more it's stories that I'm still working to get. I'm still, and I'm actually in the process right now of trying to broker more access into our hospitals, because I think one of the things that I've really noticed is that when I speak with medical professionals, which is a big part of my job, speaking with doctors, nurses, you know, people who are on the front lines of this, you hear a very different story than what the rest of the San Antonio community kind of is experiencing with the pandemic. We've been lucky enough to not have had like a patient surge like New York. And I think there's a lot of reasons for that, which have to do with, you know, international travel, kind of congestion when our lockdowns went into place and things like that. But our medical community is still pretty exhausted, and they are still dealing with very sick patients. We've had dozens of people who have died, and I think that's been really hard on medical workers. And they just have a very different approach and to the pandemic than the rest of the city. And they, I think, view the disease in a very different way than people who've only read about it and haven't had it touch their friends and families yet, luckily, because our disease burden is a little bit lower than some other areas, which is not to say that it won't go back up again. And I think that that's something that a lot of medical professionals are also worried about, is kind of, as we start to ease these lockdowns, kind of where our local infection rate's going to go. So one of my big priorities, and something I'm working on right now, is to try to do more reporting from inside the hospitals in the way that I normally would. I have been able to do it a little bit, and one of our photographers, Bob Owen, did an amazing job on a story a couple of weeks ago where he was in 2 different COVID units in the same week, and he did an incredible job illustrating the peril that medical workers are in as they just try to go about their daily jobs and having to protect themselves from a virus that, while does disproportionately affect older people and people with underlying conditions, can also have really bad outcomes in younger, healthier people, because we don't know everything there is to know yet about how and why it affects different people. And even with like things like the flu, young healthy people still will die from that too, just because of, you know, statistically, some people are just gonna randomly have bad outcomes. And so I think that one of the things that I'm trying to prioritize moving forward is making sure that I can get in there and tell those stories, because I think it's really important for the public to see what's happening in hospitals, because that's just not something they normally get to see. One of the things that is a challenge with that is HIPAA, because hospitals are very concerned about protecting patient privacy. I think you have seen a lot of access from journalists, you know, but it's a very careful balance that we have to strike, because, you know, the hospitals are really concerned about telling the story of their patients, but also protecting the privacy of their patients too. And so that's something that I think I'm going to be working on a lot over the next couple of weeks.
One of our questions came from our Congressman, Joaquin Castro, who wondered how the newsroom and journalism was going to change. And I'll take this one, and if anybody wants to come in, we're on our last couple of minutes. And that's that I think the community of journalists has really risen to the occasion. My fellow brothers and sisters in the industry have outperformed themselves. It's been moving to see how they're willing to risk their lives, and especially photographers who have just done an amazing job out there of of bringing the photographs to us that we don't normally see. And as you remember, some of those have gone viral and have gone national because our photographs have been so moving. So thank you for listening, Congressman. And I want to take a point of privilege to thank all our sponsors over time who have always been with us and helped us give hundreds of thousands of dollars in scholarships to young journalists of every stripe. I'm very proud that we have given scholarships to Black journalists, Hispanic journalists, Asian journalists, the daughter of a refugee who went on to a New York Times fellowship, and to Francisco, who may be the only scholarship recipient who's gotten 5 scholarships because he keeps going back to school, which is awesome, and he was one of our presidents. So thank you to all of you for joining us today. We didn't get to all the questions. I think that's a testament to your support of us, and thank you for joining us, and thank you all of you panelists for joining in.
Thank you.
Thanks so much for having us.
Thank you very much.
Thank you.
This is great. Thank you.